This presentation addresses the issue of eating disorders in adolescent populations. As a future school counselor, this topic was of great interest to me for a few key reasons. First, eating disorders are becoming more prevalent in the adolescent population, which can lead to serious and life-threatening physical and mental health issues. Second, the rise of social media, which most American teens use on a daily basis, can be seen as a large contributor to the increase in eating disorders. And third, school counselors are uniquely positioned to provide both eating disorder prevention and intervention care for students. Since many students do not have access to appropriate professional services outside of school, school counselors have an opportunity to provide that care. In order to answer the research question, how can school counselors play a role in reducing the prevalence of eating disorders in high school students, ProQuest and Academic Search Premier databases were used to locate 10 empirical peer-reviewed studies. In reviewing and analyzing these studies, the following themes emerged: protective factors, prevention programs, and early intervention. Protective factors are characteristics, behaviors, and environmental conditions that reduce the likelihood of developing an eating disorder. Some protective factors that have been shown to reduce the likelihood of eating disorder development are body appreciation, intuitive eating, and self-compassion. School counselors can implement lessons that aim to increase these factors at little or no cost, making them effective in the school setting. Prevention programs such as the Body Project and the Dove Confident Me program have also shown to be effective in preventing the onset of eating disorder symptoms. The Body Project is a dissonance-based prevention program that aims to reduce thin ideal internalization. Through activities that challenge the thin beauty ideal, students naturally shift their attitudes, leading to increased body appreciation. The Dove Confident Me program is a media literacy and body confidence program that helps students critically analyze media and build self-esteem and body appreciation. Additionally, early intervention is key when it comes to reducing the prevalence of eating disorders. By implementing lessons that build protective factors and research-based prevention programs that target both high school and middle school populations, school counselors can play a significant role in decreasing the prevalence of eating disorders in adolescents. There are some limitations to this literature review. Sample sizes were small and included only female participants. Participants in the included studies were also of a higher socioeconomic status. Future research should address the application of eating disorder prevention techniques and programs in rural or low-income districts. More specifically, a quantitative research study is recommended to explore the following question: how can targeted prevention programs impact student outcomes relating to the prevalence of eating disorder symptoms in rural, low-income school districts?